I wanted to just do a video just educating people on how to bill for COVID and what's available. I know that there's like the mass vaccination sites, and then there's doctors who are seeing patients with COVID. How do we do billing for COVID?
We have a new set of CPT codes which has been introduced since the COVID-19 started, and the reason for this being is for better tracking, reporting, analysis, and to be data driven. Obviously, the planning and the allocation. So these codes help reporting the actual work of administration and also the necessary counseling provided to the patients or caregivers, and obviously updating the electronic record. So we have three set of category 1 CPT codes for COVID vaccine: 91300, 91301, and 91302. Each of them differentiated by the dosage: 30 mcg per zero point 0.3 ml, 100 mcg per zero point 0.5 ml, and 5 cross 1010 viral particles per zero point 0.5 ml dosage. So all three are given by intramuscular use. Moving on to the next one. So these vaccination or administration codes, they are specific to each vaccine or dosage given. So the vaccine administration codes report the work of administering the vaccine. It also includes counseling of the patient or the person who's caregiving to the patient, and obviously documentation in the medical record. So we have four set of codes for the vaccine codes, starting with 0001A, and this is given as first dose only for Pfizer vaccine, the dosage being 30 mcg per zero point 0.3 ml dosage. Next one being 0002A, dosage 30 mcg per zero point 0.3 ml dosage, and this is for the second dose of Pfizer vaccine. So if the Pfizer vaccine first and second dose is given, these are the codes which has to be used. And next, moving to the Moderna vaccine only. The first dose would be 011A, dosage being 100 mcg per zero point 0.5 ml dosage. And for the second one, 0012A, dosage 100 mcg per zero point 0.5 ml, second dose. So let's see an example of how it would look on a claim when you're billing out. So for Pfizer vaccine, the first dose or the second dose, these would be the codes which will be entered on the claim. So the vaccine code would be 91300, administration code would be 0001A, ICD-10Z23 is the exposure code, and this is the NDC code, the national drug code for the first dose. Similarly, for the second dose, the vaccine code would be 91300, administration code being 0002A, ICD-10Z23, following with the NDC code. And this is an example for Moderna vaccine, first and second dosage, and respectively their vaccine administration ICD would be the same, and the NDC codes respectively. So this is like a clear representation, the COVID-19 vaccine and the administration, along with what you could see is the vaccine modifier, the SL modifier given. What has been presented over here is like the general guidelines overall. But if the providers wants to check, how the reimbursement rates are state-wise, there's a link given in this PPT, which you can clearly see, and this will help the practices and the providers to have a better understanding of what is allowed or how it could be billed or reimbursed in their specific states. And these are for the Pfizer first and second dosage, Moderna, AstraZeneca, and Janssen. We also have the differentiation by age-wise, 16 years of age and older, 18 years of age and older. What we have to note is the administration CPT codes are specific to each vaccine manufacturer and dosage. So the main question, how to bill for COVID-19 short administration. You could bill them each patient, each claim wise, or you can send them out as a roster bill for multiple patients. Only point to be noted here is that there is no other service provided, it's just the administration of vaccine. In that case, a roster bill could be done. Second point to be noted is when the COVID vaccine doses are provided by the government without charge, we need to bill only the vaccine administration code or the admin code. At no point the vaccine codes have to be there on the claim. Some practices, though, they do include the vaccine codes, but they had it as a $0 charge just for the sake of reporting or documentation purposes. So that is also allowed in some cases. And the third point is, if the patient or the group of patients are participating in Medicare Advantage plan, they need to submit the COVID-19 claims to original Medicare for all the patients enrolled in the Advantage plan of 2021 and 2020. And these are the reference links for further questions or any latest updates that we have received. Anything that you would like to ask us, Tanya?
Yeah, actually, if you could go back a few slides, a couple of questions. Yeah, just keep going
Mm-hmm.
back. Okay, so these are the CPT codes, and these are specifically for the injection, correct?
Mm-hmm. Yes.
For the different types of vaccinations that are administered. So if you go on to
Yes.
the next screen, um,
Mm-hmm.
administration codes are not CPT codes, correct?
These codes are categorized as, though it looks like HCPCS, but
Mm-hmm.
these codes are categorized as CPT codes. In our system, it falls under CPT code search, Daniel.
Okay.
Okay, so they'll be in the same search as CPT
Yes.
codes.
Yes, Daniel.
Okay, so are they CPT codes, or that they're like a subset, or there's different, but they're in the same search?
Now, usually CPT codes are like numeric codes. Most of CPT codes are numeric codes, though it looks like HCPCS codes, but these codes falls under CPT categorization.
Got it.
Okay, it's a CPT code.
Okay, got it. Got it. Okay, so we need the administration code if it's from the government, but we don't need the CPT code. So say the government is giving it away for free.
Okay, for every, for example, for Moderna, for AstraZeneca, and then for another vaccination, for each type of vaccination, like they have a unique CPT code, and then for that specific type of vaccine, there's a separate administration code. So when a provider bills, they have to bill the code which is for vaccination, and also for giving the vaccination to the patient. There's a separate code which is a administration code. They have to bill both. But since vaccination is free for all United States citizens, so you should not be charging anything for the vaccination. It has to go with $0 charge. For administration, Medicare rate is $40, but it varies. There I see like there's an insurance pays $50, $60. There are a few customers of us, like they usually send the administration charge with $75. Based on their contract with the insurance company, the reimbursement varies. So they should be billing both vaccination code, that's for the injection they're giving, and then administration for administrating the vaccination. They have to use the administration code. They have to bill both.
Got it. Okay, so a CPT code means what I've done to the patient. It's the injection. And administration code, does that mean like the person administering it? Like, I guess, let me expand on like what that means. Is that similar? It's just like, I guess they're paired.
Okay, CPT code. Okay, both are CPT codes. Okay.
Okay.
One CPT code 91300. That's for the vaccination. Okay, that's for the injection. That's for the vaccination. And then you see on the code 001A. That's for administration. Uh, that's for injecting that vaccination to the patient. For that service, you send a separate charge.
Do you
Okay, so
always
you
have
can.
to?
Yeah.
Yep.
So since vaccinations are free, the provider can bill the insurance company only for the administration, but still they have to report the vaccination code to the insurance.
I see. But by free, you mean, so say someone has, I don't know, Blue Cross,
Mm-hmm.
and then they go get a vaccination. It's free to the patient, but not to the payer. Is that right?
I think it's the provider cannot bill insurance for the vaccination. Provider can bill only for the administration. Uh, since
Okay.
I think like vaccinations are supplied by government to the providers.
Got it. Okay. So that really, okay. So like when if someone goes and gets their vaccination today, and then a provider has the vaccination like on site and they administer it, say it's Moderna,
Mm-hmm.
and the patient has Blue Cross, just giving an example.
Mm-hmm.
Patient goes in, doctor gives them Moderna, first dose.
Yeah, first dose, then they would be billing 91301
Okay.
with the charge of $0 because they got that vaccine for free from the government.
Got
And
it.
then for giving that vaccine to the patient for that service the doctor does, they would be billing the code 0011A with the charge amount that varies from practice to practice based on the geographical location. Usually, from my experience, I see like most of the customers billing for $70 to $80, and that they get paid around $40 to $60.
I see. In this case, Blue Cross is paying out for the service, the actual doctor's time, but they're
Yes.
not paying out for the vaccination code, like that's free
Yeah.
from the government. So the government is giving those away for free to all people.
Yes, Daniel.
Okay. Now, what is the vaccination modifier? Like, what is that? Is there anything we should know about that, or what does SL mean, or just
Um,
is
it's a states applied vaccination. That's what it means. The modifier is
okay? Does that change ever, or it's always the same?
it's the same for all the vaccines.
Okay, it's actually pretty clear. And these are all, so are all of these going out across the United States? Have you guys seen that? Like Pfizer, Moderna, AstraZeneca, which ones are actually being administered that you've seen? I know Moderna is.
The maximum we have seen is Pfizer and Moderna per the clinical documentation that's common.
Okay.
Very rarely for Aka or Janssen.
I think
Fine.
AstraZeneca still not got approval in the United States. Brenda mentioned we're seeing only Pfizer and Moderna. And
I
then we
see.
might see some Janssen, but AstraZeneca, I think as of now, like they haven't got approval in the United States.
Got it. Okay, so we're just not. Is that out? So the codes are there. It's prepped. So they created the codes. It's just not. They're not administering that one.
Yes, so as soon as they get an approval in states, or once doctors start using it, they would be using those codes. So basically, they can from the schedule, they can just click on the appointment, and then they can go to the billing tab, and then here in the CPT codes, they can enter the code 91301, which I believe it's for Pfizer,
Okay.
and then here they can pick the modifier SO and pick up this administration code.
Okay.
Okay. So there's certain insurance which does not accept $0 charges. So I suggest like putting just 1 cent. And then for
Oh, so
administration,
okay. So Dr. Chrono doesn't accept zero charges right now.
uh, yeah, we transmit it, but sometimes for certain payers, clearinghouse as instruction, they reject the claim. Sometimes payer rejects the claim. So it's advisable just to use 1 cent so that it just goes through the claim scrubbing system.
Got it. Okay.
Okay, and then you enter the administration code, and then I believe there's a NDC code for Pfizer. Brenda, do you have the NDC code for Pfizer?
For Pfizer, first dose, right?
Yes,
Okay, 59267 1001.
203. So,
Okay. So that
so you pick that NDC code and then link it to the first procedure 91301. Then just save. Okay, make sure the insurance detail, everything is entered, and then you choose bill insurance. The claim goes out to the insurance company.
so you don't even need to go into the medical record, right? For these, they just come in, they just get their shot, they walk out, and you just go to this screen. Is that right? Or
Yeah,
is there other?
Yeah, for billing, you'd have to do that, but for documentation purpose, you have to
I see.
do that.
Okay.
Okay, for billing, you can actually do it. For entering the CPT codes, sending the claim out to the insurance company, you have to do that. But of course, sometimes insurance requires documentation to process a claim, so it's always advisable. They have to do the documentation as well. But just to send the claim out, you can just do it from the screen.
I see. So you recommend putting some documentation in, giving the shot, and then
Yeah.
Okay. Just go into the clinical.
They can create some templates to auto-populate the codes, and then they can just do it from there. they can do it from here as well.
Got it. Now, what do you recommend for like clinical? Just like, I guess, whatever they do on top of that. So they may check their temperature.
For the clinical documentation, I mean, usually the triage is done and, the vitals are checked. Just
Okay.
conversation, if in case if there's any conversation that happens between the provider and the patient, and the which vaccine was given, what dosage was it, and if any reaction or anything that, the patient has to say, a bit of that would be helpful.
They're doing a lot of these in mass volume. They just kind of,
Mhm.
doctor sees patient leaves, and then they do the next and the next and the next. The nurses are doing it quite at like high volume. Okay, so like a little documentation, like they make people sit like and wait after they get the shot. I don't know if you guys got the shot, but they make people wait like 15 minutes or so after they've got their vaccination, just to see if they either faint or there's something wrong. So
Mhm.
I guess that would be part of the documentation that
Yes.
maybe they put there. Okay.
As of now, these are the updates that we have in hand. It could change in upcoming months, and as I mentioned previously, insurance-wise, there is a slight difference in the codes or in the diagnosis that are to be selected. When the claim goes out for to avoid the denials and all. So that's the only thing. But other than that, this is it.
One other question. Uh, is
Mhm.
there a time bound on these? Meaning like the service fee, that administration fee, if the doctor sees, like, I don't know, say they see 1,000 patients and they administer the vaccination for 1,000 patients, is there a time limit before they have to submit? Is it like a normal claim? Like, will they deny the administration fee if you submit like 7 months later?
Yeah, every insurance will have their own timely filing limit. Okay, for Medicare, it's 1 year. Then for BCBS, it's mostly 180 days. For youths, it's 90 days. So every insurance has their own time limit. So within the time limit, they have to submit the claims out.
Okay, or they'll lose their administration fee. Okay,
Yeah.
so they have to do it pretty quick. Okay. Um, okay, I think this was great, guys. I think that was honestly all of my questions.